going to drink to Ron for us. With a lot of vision.
Okay, all right. Thank you, Rhoda. Very nice of you.
Thank you
Nice
for
of you.
inviting us.
Thank you for being here. It's wonderful to have you all here. This is a real treat for us. We have been holding a number of what we're calling listening tours to listen and not talk, which some of us find very hard to do. And so I'm going to talk just a little bit to just let you know a little bit about what we're up to and what the evening's about. And they're going to come in soon and serve dinner for us, and we'll just be able to visit for a while during dinner. And then we'll move into a series of questions that Bob McKinnon is going to ask of you. And really, we're just going to sit back and listen to your ideas about what you might think should be required and we might want to work on as a community of people to improve the health status of the population. And that's South Coast, it's Santa Barbara, it's Goleta, it's Santa Ynez, it's the county, really. And I'll just give you a little background on this because it comes from a decision that our board made last fall after a year before that at the Alisol, where we hold our board retreats. We had a session with the Dean of the School of Population Health Management at Jefferson University and educated ourselves on what population health is. And so there's it's an effort for hospitals, and Cottage is adopting this philosophy of moving outside the walls of the hospital, where we're very used to taking care of patients. We just earned 5-star ratings. We're very, very proud of that. Only 9 hospitals in the state got that quality recognition, and 2 of them are the only 2 in Goleta and Santa Barbara were the only 2 that qualified for that distinction. So we do a good job of that, but this is trying to use our facilities, our resources, and I hope our partnerships to get at health disparities in our community, health issues in our community, and really raising the health status of the population. And to do that, we've all talked about that for a long time. But at our last board retreat, the board actually changed our mission statement so that our mission now says to provide superior health care and to improve the health status of our communities through a commitment to our core values, which are excellence, integrity, and compassion. And so it's very real. When our board, and CJ knows this very well, having served on our board for 9 years, when they actually put words like that in the mission statement, it really becomes a driver for us. And so now we have to back it up and just figure out what does that mean, how do we do this. And so we're, the first decision was to recruit some people who know something about this. Elizabeth Majestic is our Vice President for Population Health. She would be here tonight, but she had a very tragic family emergency that occurred on Sunday, and she's in Ohio taking care of that. And if you haven't met Elizabeth, you'll really enjoy meeting her. She was at the Centers for Disease Control for 23 years and has experience working with a lot of communities on very specific interventions that might be addressing childhood obesity or immunization rates or things of that nature. And so she's going to provide a lot of knowledge, content knowledge for us to move this forward. Our board has a population health task force. It's chaired by Dorothy Largay, who serves on the Cottage Health Board. Some of you may know Dorothy. We were able, Elizabeth was able to recruit Maddie Fry. Maddie is her expertise is in evaluation, and she's the director of population health evaluation for Cottage Health now. And I mention that specifically because to do this well, you have to do a really good job of evaluating the interventions that you put into place. And if you don't have data and you're not really asking the right questions, and did we drive BMI down? Did we improve immunization rates? Did we address issues around the homeless and things that we know go right to health status, and evaluate those interventions? We're not going to know what we're doing here. So Maddie's going to provide a lot of support there. Monica Ray is about to leave Cottage to, unfortunately, she's very happily married to somebody who's moving to Chicago, and so we're losing Monica. But Monica has been heading up our community benefit program. Cottage spends a little over $2 million a year, and we're very quiet about that, but we spend about a little over $2 million a year in direct financing for nonprofits in our community that provide services that really complement the work that we do, but it's not patient care. It's really more in the world of social determinants. So we provide a lot of funding for the Santa Barbara neighborhood clinics, for Doctors Without Walls, for the shelters, for Rescue Mission, and others. And so Monica's headed that program up with a community grants committee that makes those decisions. And then we have some experts with us tonight, Allison and Bob is going to facilitate the discussion. Their expertise is, I won't do this justice, Bob. You'll do a better job when you introduce yourself. But what I know about this is that Bob has works very closely with nonprofits and with communities who are very interested in this topic. And one of the things that he's helping us with is laying the groundwork, the baseline for kind of where are we now and what do people think we ought to work on and what does the data show. So we're doing a community health needs assessment right now. Doreen, you've seen these, the county's done them for many years. We've done them every 3 years, but this one is being done with Elizabeth's help. It's being done in a much more robust way. We're taking it down to the cross street level. We're oversampling low-income populations, and from that we'll have a lot of data from the whole county on what some of our health issues are in Santa Barbara County. And then you're invited here tonight to respond to a series of questions that Bob will ask after dinner is served, and we have that underway, that will really ask your opinions about that. And so we're putting the data together with all the information that we're getting from community leaders, supervisors, nonprofit leaders, first responders. There was a session this morning with first responders, a session today with clergy, and we have 2 more sessions tomorrow, and we're just getting as much input as we can in this. And all of this is leading up to, all this data, by the way, will be available to anyone who wants to use it or look at it, for the county, for nonprofits. We work closely with Dr. Wada on this. But all of this is going to help us prepare for an April summit where we're going to invite the community to help us. I shouldn't say help us. We're going to jointly decide what are the 2 or 3 things that we really ought to be going after, and what are those issues that we should be tackling, and what partnerships can we create, because none of us can do this by ourselves to accomplish that. So that's, in a big nutshell, that's kind of what we're about here. And as I said, for us it's a listening tour, so we're going to sit back and enjoy the evening, and I hope you will too. And we see this as really the first step toward a journey of partnerships in Santa Barbara that can address some issues that will make us an even more healthy community. So again, thanks for being here, and I think they're going to serve dinner soon. And Bob, maybe you'd like to just give a little bit of background about yourself before dinner arrives, and then we can go from there.